This edition of Prisma Health News with Nikki Stafford and Kendra Rorabaugh begins right now.
Welcome to the Upstate edition of Prisma Health News. I'm Kendra Rorabaugh.
And I'm Nikki Stafford. Today, we will bring you the latest information on what's happening around the organization and also share stories about how our team members are making a difference at work and in our community. We have a lot to share with you today, so let's start with the finance pillar.
In finance news, efforts are underway to replace several applications and systems, including Lawson and SuccessFactors in the Midlands and eNet and SuccessFactors in the Upstate, with a new platform called Workday. Kevin Hodge explains how this new platform will benefit all Prisma Health team members.
I think our team members are really going to enjoy Workday. In fact, when we go live with Workday in 2020, our team members are going to be able to access their pay stubs as well as PTO balances, all from their mobile devices. Our leaders are going to find very robust reporting and analytic tools to help them better manage their departments. And in certain situations, our leaders are going to have access to real-time data. So I'm really excited about our partnership with Workday, and I think it's going to benefit Prisma Health for years to come.
The Workday team is collaborating with departments across Prisma Health to design and begin the initial build of the system. Next steps include configuring the system and creating prototypes for team members to test. Watch for updates on Plexus and through team member communication channels across Prisma Health.
Under quality, the Cancer Institute now has the most advanced technology integrated into the TrueBeam linear accelerator for radiation therapy. Let's listen as Dr. Emery McTire describes its function and benefits.
SBRT stands for stereotactic body radiation therapy, and it's a very precise form of radiation therapy. It's also a very high dose of radiation delivered per day. So this new technology that we've added to our machines recently allows us to be much more precise with our SBRT and also with our radiosurgery. And so between those two modalities, we can treat many tumors in ways that we weren't able to do in previous years. So that includes lung cancers, prostate cancer, brain tumors, spine tumors, you name it. Aside from the actual convenience, aside from the fact that the patient is done much quicker, they're done in a week and a half rather than 8 to 9 weeks, which is what we've done traditionally. It also seems to be much less toxic, we're more precise, and the side effects are less.
To learn more about this new technology, call 864-888-3717.
In service news, construction on Grove Point Hospital will begin this fall, with completion slated for early 2021. Here's Dr. Karen Lommel to share information about the new facility.
We are very excited about the opening of the Marshall I. Pickens Replacement Hospital. It'll be a 65-bed acute hospital with 25 offices in the first floor to increase access for our outpatients, along with the partial hospitalization and intensive outpatient program, serving 22 to 30 adults for the day treatment program in that area. We also will have the first floor with 15 child and adolescent beds, increasing it from 6 operating beds now to 15. The next floor will be geriatric beds, increasing to 12 from current operating beds of 6. And the other side, our intensive management unit will increase to 12. And on the top floor, we'll have 26 adult beds.
As part of an ongoing initiative to grow the number of high-quality psychiatric providers in the upstate, this new facility will include teaching space to support psychiatry residency programs and a new child psychiatry fellowship program.
Have you heard of Breakthrough 1.0? Well, Breakthrough 1.0 aims to make Prisma Health a highly effective and efficient organization by taking advantage of everything we, as a health company, have gained by bringing Greenville Health System and Palmetto Health together. Will Chapman, Executive Director for System Integration and Optimization, explains.
To date, 15 operational councils have met and are identifying best practices from both affiliates, as well as standardizing equipment, supplies, policies, and procedures. Clinical leaders from both affiliates are currently reviewing patient safety processes and practices. Also, preparations are underway to convert finance, supply chain, human resources, and payroll applications to a cloud-based platform to create a better experience for team members. My Clinical Exchange is being expanded to the Midlands as a way to increase workforce development through academics. Work is underway to develop a roadmap to transition to a single electronic medical record system across Prisma Health. And finally, a team is evaluating and developing processes to improve patient access and referrals across Prisma Health, including the launch of online scheduling.
Let's take a few minutes to hear what's happening on our campuses. At Patewood Hospital, over 3,000 babies have been born in less than 2 years. Also, recent Guardian of Excellence and Pinnacle of Excellence awards from Press Ganey placed Patewood as a top 30 hospital in the nation for patient experience.
At Oconee Medical Campus, the Center for Family Medicine building is under construction. A YMCA will be added to the campus, and the hospital will break ground this fall for the ED expansion project.
Our Lung Center is pleased to serve the greater Simpsonville area with a new location at Hillcrest Hospital. Sleep lab services are also expanding on the campus with the opening of the newly remodeled Sleep Disorders Center.
Did you know Baptist Easley Hospital partners with Pickens County Schools, South Carolina Vocational Rehab, and Pickens County Board of Disabilities and Special Needs to host Project Search? This program provides transitional job skills to high school seniors with disabilities and special needs.
Piedmont Tech students will return to Lawrence County Hospital this fall for training. The Southern region will be adding cardiology and sports medicine to its rural health model, and Lawrence received the Premier Hospital Improvement Award. This award recognizes top-performing hospitals across 13 patient safety areas.
North Greenville Hospital has begun a process where all ED follow-up calls are made by ED nurses instead of a call center. The result is higher satisfaction scores and quicker responses to patients' questions.
In the Eastern region, construction is underway on the new Center for Family Medicine building on the Greer Medical Campus, and Greer Memorial Hospital earned prestigious advanced certification for primary stroke centers from the Joint Commission. Debbie Sharp, a patient access admissions counselor at Oconee Memorial Hospital, received the Larry M. Greer Stellar Service Award during Team Member Appreciation Week in May. Debbie was selected as the Team Member of the Year for her compassion and service, especially in helping patients understand their bills.
Check out this community news. A little free library is coming to a medical campus near you. Here to tell us more about this book sharing program is Ashley Chaffee.
A Little Free Library is a take a book, return a book program anyone can use. Patients, guests, and team members are invited to take a book and bring a book to share. Through these many libraries, Prisma Health hopes to encourage literacy as a part of overall health, increase access to books for our community, and foster lifelong readers of all ages and backgrounds. Look for a Little Free Library at each of our 8 campuses by summer's end.
The object of the Hassles program is to reduce administrative burden and remove barriers to caregiving. Here with more is Hunter Combe.
The Hassles program rewards both team members and leaders for identifying and eliminating hassles. And hassles are just anything that comes between the caregiver and the patient. So anything that gets in the way of you doing your job, we want to try to reduce or eliminate that. One aspect of the Hassles program is, of course, that if you're able to reduce the amount of time that people do spend on administrative burden, on clicking, on searching, that sort of thing, then you should be increasing the amount of time that people are able to spend with patients.
Some of you have already met our new president and CEO, Mark Ohala. We'd like to welcome him to South Carolina and look forward to talking to him for Prisma Health News in October. But for now, here he is from a recent Prisma Health leadership gathering.
The single most important thing is we're a people business. That's exactly what we do. We don't make cars, we don't build bicycles, we don't make widgets. We're a people business. And you and the other 32,000 employees of Prisma Health, you are our greatest asset. So we're going to have a lot of work ahead. The changing healthcare environment is going to force us to look at the universe a little bit differently than we have historically. But we'll do that together. We'll do it as a team. And I'm excited about that. I think the things that we're going to be able to do for all of the communities that we serve is going to be really spectacular.
As we close today, there are 2 things coming up to be aware of. In mid-August through early September, we will be asked to participate in a team member survey. In October, the HR department will go on the road to all Prisma Health locations to talk about alignment of pay practices, HR policy, PTO, benefit changes for 2020, open enrollment, and our retirement plan. Look for information on both of these on Plexus and team member communication channels across the organization.
Thanks for watching, everyone. This newscast is available on Plexus and the Prisma Health YouTube channel. You'll also find a link to it in the weekly team member newsletter.
Remember to inspire health, serve with compassion, and be the difference. Have a happy and healthy day.